There are a lot of people that are dying from COVID, but there's also a lot of people that are passing indirectly because of it. I look around and seeing what people are doing now and what the governments are doing, and it's not enough.
Those words from a grieving husband who lost his wife to cancer after her surgery was pushed back 3 times due to a lack of ICU beds. And while he'll never know for sure if the delay contributed to her death, it's something he'll never live down. And as a third wave continues to overwhelm our hospitals, we take a deeper dive into Ontario's ongoing surgical backlog.
There's about 1,200 cancer surgeries that are done every week on average. That number appears to be roughly halved.
Only the most time-sensitive and emergency surgeries are going ahead right now, adding thousands every week to the already unprecedented backlog that includes heart procedures and hip replacements. Dr. Chris Simpson is a cardiologist who heads up the medical division of Ontario Health.
Every cancer surgery eventually needs to be done within some sort of safe time frame. So the longer that this goes on, the more I do worry that patients whose care has been deferred will now no longer be deferrable anymore.
And at this point, how long are surgeries being deferred for? Is it just a matter of a week or two, or is it longer? Is it unknown at this point?
I think it's unknown, but in general, it would be dependent really totally on where the pandemic wave crests. I've had to tell my patients that the procedure that they were booked for is now put off, and we can't even give them a new date.
Since the pandemic began, more than 257,000 surgeries have been delayed, with about 10,000 added to the backlog since mid-April. The Ontario government already announced a $741 million investment to help build more capacity within the healthcare system and clear the wait list. But that won't happen until we get the third wave under control. Would you call this a crisis?
Yeah, I would. I mean, I think it's a crisis on many levels.
Dr. Frances Wright is a breast cancer and melanoma surgeon at Sunnybrook. She tells me most hospitals around the GTA are only running about 2 operating rooms a day when normally there would be 12 or more. And right now, medical experts are worried about the so-called missing patient, those who should be seeking medical attention but are steering clear of the healthcare system.
We'll see a stage shift in diagnosis, i.e. patients are coming in with more advanced disease and they'll require more intense treatment. And that will play out in the data for the next 3 to 5 years, I would guess. It's going to be challenging to watch.
Now, Dr. Wright is encouraging you to get screened and to follow up with your family doctor if you are experiencing symptoms. She says right now it's more important than ever to get an early diagnosis.